Thank you, everybody, and good morning again. I'm Farah McDade-Ting from CSAC. We have a really interesting webinar for you this morning, and I appreciate everybody signing in today. Afghan arrivals, what counties need to know. What folks here on this webinar need to know is that we have some housekeeping items, but also we want to thank our state partners who really are providing the information in this webinar and have made this possible to share with you all. We're partnering, of course, with the California Health and Human Services Agency, the Department of Social Services, the Department of Public Health, and the Department of Healthcare Services, as well as some other agencies, including some housing agencies on the state side. For counties, we have the CSAC team, the HHS team, which includes myself, as well as Justin Garrett and Rashina Duree. And we have our folks on the CSAC comms team, including Portia Green and Michael Sweet, who are helping out today. In the interest of time, and because we have a lot of information to provide today, I'm not going to introduce each speaker, other than to say the folks from those 4 or 5 state departments, again, have made this entirely possible by being willing to share this information and being willing to do it in less than a week. We organized this webinar very, very quickly because the issue is important and urgent right now. But the state folks have done a Herculean job in helping us understand the issue and are here prepared to impart that information to you today. Again, for questions, please type them in the chat box and we will get started. I'm going to kick it to Marcela Ruiz from DSS. Marcela?
Thank you so much, Farah, and thank you to CSAC for inviting us today. My name is Marcela Ruiz, and I am the Director of the Office of Equity within the California Department of Social Services. I just want to take another moment to thank my colleagues from the Department of Public Health, Healthcare Services, and for San Diego County for joining us today. Within our department, within CDSS, we administer the federally funded refugee program, which supports refugees with social services once they are settled into community. Today, we wanted to both provide some context by sharing an overview of the federal resettlement process and lift up how Afghan resettlement may be departing from the norm in important ways that could have implications for all of our systems and raise questions for counties from both partners and stakeholders. So first, I wanted to start off by clarifying some terminology that you may hear in relation to Afghan arrivals. These terms that you see up on the screen are related to immigration status and have implications for an individual's long-term prospects of becoming a permanent resident or getting a green card, and also being able to access the safety net and special resources for refugees. So the first term that you see up on the screen is refugee. And as I've been doing, we often use the term refugee broadly when referring to individuals involved in a humanitarian international emergency like the Afghan arrivals. However, I did want to note that refugee is actually a narrow legal term, both in international and US immigration law. It refers to an individual unable to return to their home country due to a well-founded fear of persecution based on 5 characteristics, including religion and political opinion. The designation for a refugee has to happen abroad, and refugees arrive in the United States with a refugee visa, and then they have a pathway to becoming legal permanent residents and citizens as well. The other term often associated with the Afghan arrivals is that you may be familiar with is SIV, or Special Immigrant Visa. This term refers to a program that was created by Congress specific to Afghan and Iraqi nationals who are targeted because of their work for the United States. And so it allows them to relocate to safety in the US through the Refugee Resettlement Program. Like the refugee processing, SIV, the visa processing has to happen abroad. And we often use the term SIV and refugee pretty interchangeably because they have similar pathways for coming into the United States and eligibility for benefits, which we will talk about in a moment. And then finally, another term that you may hear associated with the Afghan arrivals is humanitarian parole. And humanitarian parole is a term within the immigration context, and it's a special permission to enter the United States based on urgent humanitarian needs, and it's at the discretion of federal officials. It is not a visa, and it is not typically associated with the refugee resettlement process. So here again, want to be able to provide some context for what refugee resettlement typically looks like. So for people coming into the country with special immigrant visas or as refugees, this is the process that they would normally go through. The Refugee Resettlement Program is a federal program involving 3 departments. It typically begins with visa processing outside of the United States, led by the Department of Homeland Security. After that, the Department of State, through the Bureau of Population, Refugees, and Migrations, or PRM, coordinates and funds the placement of refugees into community through 9 voluntary agencies who work with their local affiliates known as resettlement agencies. And we'll talk a little bit more about resettlement agencies, who are nonprofit organizations like the International Rescue Committee, IRC, Jewish Family Service, World Relief, Catholic Charities, and others that you may be familiar with. And those organizations provide the reception and placement services for arrivals, for SIVs, for refugees. Those services are a suite of services during the first 90 days of a refugee or SIV's presence in the United States. And it involves meeting people at the airport, housing them both initially and longer term, orienting them to the United States, and connecting them with integration services, including health and social services. In California, there are 18 resettlement agencies. Finally, the third federal department involved is the Department of Health and Human Services. Through the Office of Refugee Resettlement, or ORR, they administer funding for longer-term public benefits through allocations to states. And these are special benefits for refugees or SIVs, cash assistance, employment services, and health services. In California, these funds flow from the state through the county system. And I will note that refugees and SIVs, in addition to being eligible for refugee-specific benefits, are also eligible for federally funded benefits, including SNAP, Medicaid, and TANF. And we'll make the distinction between the federally funded and the state-funded benefits in one moment. So the Afghan resettlement process has been different, and it has departed from the standard process that I just very quickly ran through in the last slide. Because of the speed at which the situation in Afghanistan devolved, the federal government was not able to process the applications of all of the individuals who were applying for SIV status before the Afghan government collapsed and we closed our embassies abroad. And again, we're not able to process people abroad. So again, as I mentioned at the top of my presentation, for SIV status, refugee status, you must be processed abroad first. Instead, the federal government had to quickly evacuate Afghans. And that is why we are issuing, or the federal government is issuing, a special permission for them to enter the US called Humanitarian Parole. Again, this is not a refugee immigration category. It's not the SIV category. And so that means that people who are coming in with this special permission are not eligible for the same suite of benefits and supports that SIVs or refugees are typically eligible for. And we will talk a little bit more about the eligibility for the state-funded benefits in one moment. As you will see, the federal up on the slide, and we are learning some of this information is rapidly changing, and reports are coming in both through the press and through our federal partners. The federal government did evacuate over 100,000 individuals from Afghanistan. That includes US citizens, legal permanent residents, some SIVs, and this category of Afghans who are coming into the country as humanitarian parolees. We understand from the federal government that they are projecting that about 50,000 Afghan humanitarian parolees will arrive in the United States. That's nationally. Of those 50,000, we don't yet know how many will arrive in California. The humanitarian parolees are first expected to arrive in military bases, mostly in other states, not in California, bases such as Fort Bliss, Fort McCoy, McGuire, Dix, and others, where they will be processed, receive medical attention, receive immigration processing, including the humanitarian parole designation and employment or work authorization. As I mentioned, we don't yet know how many individuals will ultimately be placed in California. We have some historical figures that point us perhaps to be able to estimate. In the past, 36% of SIV arrivals have resettled in Sacramento. Sacramento is the county that has received the most SIV arrivals in the nation. We don't expect this high percentage to hold with this new wave of arrivals. And in fact, there's currently a moratorium on Afghan arrivals being placed in Sacramento because of the high numbers. What you see listed on the slide is the counties, all of the counties in which we expect for Afghans to be resettled. And they are listed in the order of the numbers we expect, from the largest numbers to the smallest numbers. What we can share today is information as of last week reported by the resettlement agencies. So far, we understand that there have been just a little over 1,200 Afghans placed in California with resettlement agencies. Again, with the most being placed in Sacramento, just over 680 in Sacramento, just over 250 in San Diego, 100 in Stanislaus County, and then 44 in Alameda, 63 in Contra Costa, and about 70 in Los Angeles. We are continuing to monitor the situation and collect information from the resettlement agencies. Again, because of the urgency of the situation, we are and the fluidity of the situation, the information is sometimes changing on a daily basis, and we are in contact with both with our federal partners and with our local partners in order to be able to consolidate this information and share it with counties and other stakeholders who will need this information for planning. And now I would like to turn it over to my colleague, Dr. Christine Murtho from the California Department of Public Health, to talk a little bit more about the public health services and the implications for that system.
Thank you, Marcella, and everyone for being here today. I'm just going to talk a little bit about the medical process of arrivals from Afghanistan. So as Marcella mentioned, the majority are arriving to US military bases throughout the country. And so when on arrival, they receive a basic medical screening, not our current process, the more comprehensive following CDC guidelines for domestic medical examinations for newly arriving refugees, but a basic medical screening, including COVID-19 testing, which is on arrival and which is repeated in days 3 to 5 if they're still on the military bases, a tuberculosis screening, and then immunizations for COVID-19, measles, mumps and rubella, and polio. So if they didn't go to a military base, let's say someone already has their SIV status and has a family connection that they would like to connect with, USCIS is requiring a visit, a screening within 7 days of to make sure that they have measles, mumps, and rubella vaccine, polio, and at least 1 dose of the COVID-19 vaccine, absent a proof of that vaccination, and then also a TB screening, and then they need to report that to USCIS within 7 days of arrival. In terms of medical records, typically we receive overseas health exams through the CDC's electronic disease notification system. And so because of the evacuation, the system there are some exams that may currently be in that system. And then there are other exams that they're just being sent directly to the state refugee health coordinators. We've set up a site where the refugee health assessment programs can actually download those records, medical records. And all of our counties have been able to access those records. Some people that are seeking SIV status may just, need a final panel physician exam. So, and usually that's done overseas. And what they're doing right now is on the military bases, they're offering a civil surgeon exam, and that document, the I-693, will be transmitted to our state Office of Refugee Health, and we will share that with the counties. And currently, because of the processing of the medical screenings and immunizations at the U.S. military bases, the CDC is also setting up a separate platform that we can access that information. The CDC has issued some guidances for the state on quarantine recommendations. If someone is not fully vaccinated, so less than 2 weeks since the vaccination, if, for example, if they received a vaccination at one of the U.S. military bases, but it's been less than 2 weeks. So on their final arrival to the destination of California, the recommendation is to quarantine for a full 10 days. If not further tested after days 3 to 5, or quarantine for a full 7 days if tested within 3 to 5 days after arrival. Those that are coming in fully vaccinated, so more than 2 weeks after receiving their COVID vaccination, are just asked to self-monitor for COVID symptoms and then isolate and get tested if any symptoms develop. In 10 counties throughout California, we have refugee health assessment programs, which is funded by Office of Refugee Resettlement and administered by the Office of Refugee Health through county health departments. And so currently, those that are eligible, as Marcella mentioned, we have full federal benefits for those who are SIV or SISQ parolees. They have access to this refugee health assessment program. The resettlement agencies refer into these programs and they receive a full medical assessment and updates to their immunizations. If they are humanitarian parolees and do not have access to federal benefits, we have Pru-Call Medi-Cal, and they should contact their local refugee health programs to see if they can be assessed there. And if appointments are not available, they can be referred to a local provider of QHC. And I'll pass this on to Kathy Yang. She's our state refugee coordinator for the state of California.
Thank you, Christine. Good morning, everyone. My name is Kathy Yang, state refugee coordinator with the California Department of Social Services, or CDSS Refugee Programs Bureau. I'd like to thank FARA and CSAC for inviting us to this space. We are pleased to join in Governor Newsom's announcement last Friday, sharing the details of the state's response to support and assist our new Afghan neighbors. As some of you may have seen, the state's response is multi-layered, starting with the temporary expansion of the state's Trafficking and Crime Victims Assistance Program, also known as TCVAP. We've proposed an expansion to this program to include certain Afghan citizens and nationals who are admitted to the U.S. as humanitarian parolees. This request asks for an additional $16.7 million in state general funds to support the expansion of the TCVAP benefits for Afghan arrivals. As humanitarian parolees, only Afghan arrivals with children may be eligible to apply for and receive CalWORKs, and there is an expected gap in assistance available for Afghans under this status who do not have children. Expanding TCVAP will provide cash assistance benefits similar to those benefits available to refugees and other groups with different immigration statuses who are eligible to receive federally funded benefits. TCVAP is the sole program in California that is the closest in structure and eligibility to fill the service gap for this subset of Afghan arrivals. For eligible individuals, TCVAP provides up to 8 months of cash aid assistance and up to 60 months of employment in social services, including English classes, skills training and employability, and social adjustment services. Additionally, CDSS funds pro bono nonprofit immigration legal services providers through the One California program. On our website, CDSS has identified the list of legal services providers who may be able to assist Afghan arrivals with immigration legal services. Further, the state continues to fund and partner with school districts to support immigrant and newcomer youth and children. $20 million in awards have been issued to continue supporting the California Newcomer Education and Wellbeing, or CalNEW program, in the 2020-21 state budget, and $1 million has been issued in federal funding awards for the Refugee School Impact, or RSI, grant program for the next federal fiscal year 2022. This funding is allocated to school districts in under-resourced service areas with large numbers of socioeconomically disadvantaged newcomers, including school districts in regions with an increase in Afghan arrivals. Last but not least, the California Dignity for Families Fund is part of a public-private partnership with the grant makers concerned with immigrants and refugees. Governor Newsom announced an expansion of the fund, which was established to meet the needs of migrants, migrant families, and unaccompanied youth and minors entering California, including individuals and families arriving from Afghanistan. The fund has already raised $8.3 million toward its $20 million goal, with support from the James Irvine Foundation, Evelyn and Walter Haas Jr. Fund, Emerson Collective, the California Endowment, Weingart Foundation, the California Community Foundation, and Sunlight Giving, among others. I'd also like to share a brief overview of the federal and state benefits available to Afghan Special Immigrant Visa, or SIV holders, Special Immigrant SISQ parolees, and Humanitarian Paroles. The California Department of Social Services issued 2 all-county welfare directors letters last week on August 30th and September 3rd, providing policy guidance to counties about public benefit eligibility for special immigrant visa holders, special immigrant SQSI parolees, and humanitarian parolee Afghans, or HPAs, respectively. All Afghan SIV holders and SISQ parolees are eligible to apply for federally funded benefits and services, as you can see here on the screen with this chart. So federally funded benefits include the following: Refugee Cash Assistance, or RCA, that's up to 8 months of cash aid assistance for singles or couples. Refugee Support Services, or RSS, that's up to 60 months of employment and education services and supports, including assistance for housing, utilities, childcare, and transportation. The Federal Office of Refugee Resettlement funded set-aside grant services, such as the services for older refugees, Refugee School Impact, and youth mentoring programs as well. CalWORKs and Welfare to Work benefits are also included under the federal umbrella of benefits and services. You also see here CalFresh, or California Food Assistance Program CFAP benefits. We also have the Cash Assistance Programs to Immigrants, or CAPI. In terms of state-funded social services, all humanitarian parolee Afghans, or HPAs, are not eligible to receive federally funded benefits and services, but may possibly be eligible to receive the following state-only funded assistance. Under the TCVAP program, which I mentioned earlier, currently under request for potential expansion to offer up to 8 months of cash aid assistance for our humanitarian parolees from Afghanistan. State-only funded CalWORKs benefits are also available to this population. And then possibly CalFresh or CFAP program benefits are also available to our Afghan humanitarian parolees. So I'd now like to invite my colleague Sandra from the Department of Healthcare Services to share more information about Medi-Cal benefit eligibility for our Afghan arrivals. Sandra?
Thank you, Kathy. Sandra Williams. I'm here with again, I'm the Chief of the Eligibility Division at Department of Healthcare Services. I'm just going to briefly go over the Medi-Cal resources available. There are, and as you can see, and I think the bottom line here is that any individual coming over, any Afghan arrival, the counties should and will be able to find a path to full scope Medi-Cal benefits for them, whether it be they have the special immigrant visa or the special immigrant parole, SI, SQ, those would be federally funded full scope benefits. But if the individual or the family meets the humanitarian parole under certain circumstances and fits into one of the PRUCOL categories, that is state funded full scope Medi-Cal. And if, as my colleagues in prior segments have indicated, if these individuals do not have specific documentation that gets them through what we would consider these channels that are listed here, there is, and you are likely familiar with the last category of PRUCOL. The US knows they are here and does not intend to deport them. These folks would absolutely fall in that last category of PRUCOL, and there they too would be eligible to full scope state funded benefits. It's important to understand also that any individual, regardless of immigration status, who is under age 26 in California does receive full scope Medi-Cal benefits. And there are some nuances here, but I think the bottom line is, and counties know how to read these documents and fit the individuals in the particular category that they are eligible to full scope benefits. There is the signing of the MC-13 that is eventually needed. Counties are to take self-attestation as far as the Afghan evacuees status and get them into the full scope Medi-Cal category that they are entitled to, and then they can get the signed MC-13 after approval. Counties, we did issue guidance, and Kathy will be going over that in a little bit. We did issue guidance last week that outlines this for counties and eligibility workers. If there are any questions, they can certainly reach out to me or the individual that's listed in the Medi-Cal guidance, the DHCS guidance that went out last week. Thank you, and back to you, Kathy.
In terms of available resources, we encourage our county partners to view the following: the Federal Department of Homeland Security site, where there's additional details about how we can support Operation Allies Welcome in resettling Afghan arrivals. The California's Health and Human Services Agency site, which also provides quite a few resources and links. And then our California Department of Social Services Afghan Arrival Response webpage. This is a new site that we dedicated to include all of the different resources that our community partners may find useful. On the site, you will find the policy letters, all county welfare directors letters that I referenced earlier related to benefits eligibility for SIVs, SQSI parolees, and then our humanitarian parolees. We also have a link on there to the Department of Healthcare Services Medi-Cal Eligibility Division information letter that Sandra just briefly reviewed with all of you. You can access all of those letters on the site. Our policy letters are there for guidance to counties, but if you have questions about operations and eligibility criteria, please feel free to reach out directly to me. On that site, we also have a list of California's 18 resettlement agencies, Afghan serving organizations, and how you can help. So there's quite a few different resources on that site. It's important to highlight for all of our county partners that while we have 58 counties which administer refugee cash assistance and CalWorks or CalFresh benefits, we presently only have 8 refugee impacted counties in the state. Impacted counties, by definition, signify that these counties have resettled over 500 or more refugees in the last 5 years. And the counties currently include Alameda, Los Angeles, Orange, Sacramento, San Diego, San Francisco, Santa Clara, and Stanislaus. Contra Costa and Riverside County are also included in that list, but we do not currently fund refugee support services activities in Contra Costa and Riverside. And so the list is down to the 8 that I just mentioned. As Marcella referenced earlier, California has 18 resettlement agencies, and all 18 of them operate out of one of these 8 impacted counties that I just listed for you. Outside of those 8 counties, we do not have active resettlement agencies anywhere else. Each county also works with these resettlement agencies as well as ethnic community-based organizations or other refugee and immigrant serving nonprofit agencies to convene monthly refugee forum meetings. These forum meetings include participation from various partners, including federal, state, and local county city colleagues, as well as school districts, law enforcement, congressional districts, public behavioral mental health colleagues, and others. Counties that want to get further involved in supporting the resettlement and integration of Afghan arrivals are highly encouraged to reach out to these forum chairs. I'd be happy to facilitate those connections as needed. I also encourage you to reach out and work directly with the resettlement agencies who do need that assistance and support at this time. So thank you again for joining today's webinar. I will now turn it over to our County Refugee Coordinator Chair, Abdi Abdullahi from San Diego County, to share details about the County Refugee Coordinator's role and responsibilities in refugee resettlement. Abdi?
Good morning, everyone. My name is Abdi Abdullahi. I'm the CRC of, as Kathy mentioned, there are currently there are 8 impacted counties that in California, and each impacted county has designated CRC. So let me just speak about the roles and responsibilities of the all CRCs. The CRCs are the contact persons for the refugee employment service programs in the respective county. The CRCs are also responsible for managing and administering the federal funding that is and the programs that provide the refugee employment services. We are responsible for monitoring all the service providers. We are also responsible to ensure that all risk providers provide refugees and other eligible population for their rest services. We are also responsible conducting an audit to ensure that our service providers are in compliance with the refugee employment service guidelines. We are also responsible for submitting the refugee employment service plan every 2 years or every 3 years or every year as requested to the Refugee Program Bureau. We are also responsible for submitting semi-annual and yearly data reports and narratives to Refugee Program Bureau. So also what we do is, as Kathy and my other colleagues mentioned, the coordination with resettlement agencies. The RS are the vital to our resettlement process. They are the ones that resettle refugees in our respective counties. So they provide the initial reception and placement services. So all CRCs have great relations with our RAs in our counties. We also have a meeting with our RAs to exchange information and updates on the services we all provide to refugees. RAs also provide CRCs, the arrival report. Not all of them are providing the arrival report, but some of them do. So let me just speak about the county services, employment services, and other services the county provide. The primary services for our federal funding is the refugee employment services. The counties also provide refugees and other eligible population with CalWorks, CalFresh, medical, childcare, transportation, and ancillary payments, translations, mental health services, and etc. Let me speak about a little bit about housing. The initial housing of the refugees is provided by the RAs during the initial placement reception service, as you know, as my other panelists also stated previously. So also, I just want you to let you know that usually the counties have the housing and community development services department that also provide housing assistance to low-income families, which also include refugees and other eligible population. However, during the COVID-19 highest peak in last year, all the counties, all CRCs received a limited supplemental funding that was exclusively designed to provide a limited housing assistance for our refugees and other population that were participating in our program. So for example, if I just give you a little example, as San Diego, in San Diego, we implemented that program last year, and our initial program was to provide 170 families, even though it was a limited, that 170 families received the emergency housing assistance. At the same time, also for this year, for this fiscal year, as of July 1st, we're also going to be providing 250 families for that will be receiving some kind of assistance for the housing. So all the counties do have that programs, and a lot of them are also providing. Let me just also talk about a little bit about the experience in San Diego, for example, and I know all the CRCs also have this experience. We all collaborate with our RAs, school districts, service providers, ECPOs, welfare work providers. Specifically in San Diego, for example, if I give you an example in San Diego, the San Diego Refugee Forum is a very robust organization that has been for a long time. And pre-COVID-19, there were about 60 to 70 organizations who are all providing services to refugees and immigrants that are participating in that meeting. So there's a monthly meeting, and I'm sure every CRCs or every other county, impacted counties have that, even though, as Kathy mentions, they are, some of them don't have it, but in San Diego and some other larger counties do have that robust refugee forum, which we exchange information to provide any information that we receive from the state or from the federal, and the arrival support. So the coordination with educational institutions. So all CRCs also have relations and coordinate with all educational institutions that provide educations and learning to refugees, to refugee children, or those who are providing ESL and other educational training for refugees. They are a part of the quarterly consultation call meeting. Like I mentioned a while ago, we also have a quarterly consultation meeting with all the resettlement agencies, all the service providers that do provide ECBOs, any agency, non-profit, profit organizations, federal agencies, local, that provide some kind of services to refugees and immigrants. We do have some kind of quarterly consultation with the also state involved. So they provide updates and information at those meetings. We also exchange some kind of information. Coordination with other local services. All CRCs, as I mentioned a while ago, I'll have also relations to coordinate with other local service providers that include ECBOs, nonprofit, profit organization, refugee forum, local law enforcement agencies, and some counties, local and federal agencies such as SSA, UCIs that provide service to refugees and other eligible populations. In some counties, they also are a part of the quarterly consultation call meeting. They do provide updates and information on those meetings. Let me just give you in general about the challenges and opportunities. So the challenges, and this is in general for all counties. All counties reported that housing and cultural mental health services are the challenges for all counties for these Afghan arrivals, and also for other refugee populations, specifically for the Afghans that are arriving. So all, like I say, I will repeat, all the CRCs reported to me that in general, the housing and the cultural mental health services are the challenge for all counties. On the benefit side, the benefit services not eligible for some of the Afghans due to a specific code or class of admissions in their documents or the documentation. Also, what they reported is as a challenge. Opportunities, and this is for all counties, more funding for counties or other service providers to meet the needs. So that's what I have, and back to you, to the moderator.
Abdi, thank you so much. And I like the last point you mentioned, which is some questions about funding. I want to thank all the state partners for running through this. Clearly, this is a very technical issue. There are people on this webinar who have not heard of these terms or acronyms before, and others who work in this area daily. And so the questions in the chat box have been great. The state folks have answered them as they can. But I would also say we're starting our question and answer session. And so I'm going to mete out questions as we see them. We've been collecting them as they've come in as well, and we'll do our best to cover as much ground as possible in the next 15 minutes. So I want to get started here. There's a lot of questions rolling in, but a few that I saw earlier is questions about when these extended benefits like the TCVAP turn on. And I want to add to that, do we have a sense of if there's a deadline or actually an end to these expanded eligibility services? Sandra, is that a question for you?
I can.
No.
Or Marcella?
Sandra's shaking her head. I
Okay.
can pick one. So the expansion of the TCVAP benefits, again, is anticipated to fill the gap for the population that would not be eligible for other state-funded benefits. So it's primarily designed to meet the need of adults without children who are not eligible for the refugee benefits. Right now, it's a proposal still to be approved by the legislature, but as you will see from the announcement, it is supported by both the administration and the legislature, and it would be a temporary measure through the end of the budget year. But we're waiting for the approval to come through to be able to answer those questions, and then obviously there's work with our county partners to turn on the benefit once and if it is approved.
Great, thank you, Marcella. Do you anticipate that approval happening in the next 2.5 days? The legislative session ends on Friday.
I would probably be out of line if I spoke on behalf of the legislature, but I think you can read from the announcement that they see the urgency related to the situation. So I think that's an indication that there will be an attempt to resolve this issue while they are still in session.
Okay, great. I know everything's fluid right now. So there's the governor and the legislature have committed to funding, state-only funding for many of the folks in this population. Can counties access some of that funding for the administrative costs, like doing the eligibility, other things? Will there be a way for counties to access some of that funding just for the administrative costs of servicing this population?
So that's a really good question. And just a clarification that Afghan arrivals, people who arrive with humanitarian parole, are by definition eligible to the existing state funded programs. So with the existing systems and protocols and funding streams. So the administrative fee should be already included. We just wanted to clarify what this new subset of arrivals would be eligible for, because we knew there would be many questions about their eligibility.
Okay, and so for the new arrivals, is this confined to this specific population, i.e. the folks who were airlifted out of Afghanistan or who may be able to leave Afghanistan in the coming months and who are processed at the military bases? Is it narrowly applied to this special population?
It is narrowly applied based on immigration status. So okay. The rules apply differently if you come in as with a special immigrant visa, if you versus whether you arrive with humanitarian parole for at least a year or less than 1 year. And so we are expecting Afghan arrivals to arrive in the country with a special immigrant visa, a parole associated with that visa, and or humanitarian parole, and that's what we wanted to clarify for the counties and for the field, so that they would be able to identify what benefits eligibility existed depending on what immigration permission or status the individual had.
Another question, and I think Marcella, you talked about this last week, there's a lot of interest in the numbers. And we did answer in the chat that the numbers given, I think you said, Marcella, there were about 1,200 of these folks have come to California in the last month or so, with about half being resettled in Sacramento. But can you talk about the demographics, the number of adults versus number of children, I think based on previous statistics, what California might be able to expect?
I'm going to ask for my colleague Kathy Yang to maybe help with some of the numbers on the number of children. What I can share with you is that we have two data points: the numbers of individuals who have been arrived as reported to the state by the resettlement agencies, and then the numbers of individuals who are in the pipeline to be resettled. And as of last week, that was about 600 individuals. And I can share with you that out of those 600, 140 were between the ages of 0 and 4. I'm sorry, it's over 600 individuals. 140 were over 0 to 4, and 500 were 5 to 18 years old. So the population that is currently arriving it has a lot of young children. We have heard from our federal partners that in the humanitarian, and these are mainly populations that are arriving with special immigrant visa status, that many of the humanitarian paroles are adults without children. So we can expect that the second wave of arrivals will mostly be adults who do not have children.
We know in terms of the pipeline, those are what State Department, our federal partners, refer to as the assured cases, or individuals that are on schedule to arrive in the States. And that includes SIVs and SISQ parolees and refugees. And average case size, family size for this particular group, somewhere between 4 to 5. We are finding that a higher number of SIVs, so Afghan SIVs, refugees, and SISQ parolees have families. I'm sorry, did I say average size 4 to 5? Average size of 7 to 9. So we anticipate an impact or uptick to CalWORKs caseloads in our counties because of that. And young children, again, ages 0 to 4, make up about 11% of Afghan refugee and SIV individuals. Again, this is the assured pipeline or numbers. That may not necessarily be reflected in the actual number of arrivals that have been reported by our resettlement agency partners. Minors ages 5 to 18 or right under 18 make up about 38% of the Afghan refugee SIV numbers. So again, I think all that to say we have larger families coming in for Afghan refugees and SIVs. What we have heard about Afghan humanitarian parolees just in the last couple of weeks is that these, as Marcella added earlier, are primarily consisting of individuals and couples. Typical family size is somewhere between 4 to 5. And so because of that, we're anticipating, if this goes through with the TCVAP request, that there may be an impact to TCVAP versus CalWORKs. So I hope that that's helpful. We do have some of that breakdown by county. Again, these data points are fluid and ever changing. And so we are working with our county refugee coordinators in the impacted counties to share out data dashboards, and that'll be coming towards end of this week into next week.
A question from the chat is, in the chart that where we saw a lot of the services that these folks will be eligible for, they were not or are not eligible for CalFresh. Can someone quickly address what sort of food programs might be available to these folks?
Sure. So the humanitarian parolees from Afghanistan who are arriving may be eligible for state-funded CFAP. if they have if they're paroled in for more than a year. So, and as you all know, CalFresh eligibility has several other requirements, right? If you're a child, or there's just a numerous list of requirements that you can see in the ACWDL that you have to meet in order to be eligible for CalFresh. So we listed it as potentially eligible for CalFresh because there are so many other requirements, but the state-funded CFAP program will likely be available to many of these arrivals, as well as, our general food bank safety network, which is available to all. Just want to remind everyone, right, that we don't ask questions at the food banks, but you have to meet the general CalFresh eligibility programmatic details as well. So, but we do expect many to be eligible for CFAP.
Great, thank you for that, Eliana. I really appreciate it. We have some questions about, while there are roughly 8 counties or 7 that, where these recent arrivals may be resettled, what if they, a family is resettled in Alameda County, but subsequently a year later perhaps moves to San Francisco County? Do the services and supports that Alameda County has been providing, as well as the resettlement agency and other CBOs, follow that family to San Francisco, or would that family's services be transferred to San Francisco for San Francisco to provide?
So that's a great question. And I want to be very clear about the services that state and county agencies can provide versus the reception and placement, or RMP services, that our resettlement agencies provide and deliver within the first 90 days of a family arriving to the States. So in this example, if the family arrives and initially resettles in Alameda County by way of a resettlement agency, that resettlement agency in Alameda County, which I know we do have 2 in Alameda County, would provide the initial 90-day period of services and benefits. That includes airport reception to bringing the family into the County Welfare Department office to apply for public benefits. They also connect the family to housing. If they have school-age children, help to enroll the children into school. A year later, that 90-day period of services provided by the resettlement agency would have passed that 90 days, right? So if the family moves to San Francisco County, the family's case would then, if they are receiving either if in this case, let's say they're receiving CalWorks, Alameda County Social Services would initiate an inter-county transfer to San Francisco County. And then following that year of service in Alameda, San Francisco County would accept that inter-county transfer, ICT, and then assess for eligibilities, activate the case in San Francisco County. And then at that point, the family would still be eligible for cash aid assistance by way of the CalWorks program, and also welfare to work services and supports, again, including things like childcare and or transportation subsidies, as well as employment services and supports. So I hope that answers the question.
Thanks so much, Kathy. I think it does, meaning that should, like any other Californian family, move to another county, the caseload would be transferred to the county in which they're residing, using the existing processes for the transfer of cases in our, especially mental health, county social services, and other. Let's see, we have some questions about folks who may not have been part of the airlift over the last month and may emigrate from Afghanistan to other embassies or other routes. Will those folks go through the SI process, or will they potentially be included in the humanitarian parole process that we're seeing? Not sure there's an answer to this one.
No, I don't think we have a clear answer for that. We're waiting for federal partners to provide more information, but we do understand there are tens of thousands of people who are in other countries, and there are a few options for them to come to the United States. And again, as we learn more about what status people will be in, we'll certainly share with county partners, because again, this has implications for all of our systems.
Great, thank you so much, Marcella. We have reached our time. I want to thank the state, including the Health and Human Services Agency, Department of Social Services, Department of Healthcare Services, California Department of Public Health, and Abdi, who's representing our county refugee coordinators for their help and information here. I also want to note that we will be following up on this information as best we can. I know that some of the state folks provided their emails for direct questions. I also want to thank the state for being so accessible to everybody with this. And we hope you have a great day, and we'll do our best to follow up on all of these questions. Thank you.